Okay, so you're deep in the world of healthcare management, right? Trying to get a handle on the ethics, the day-to-day operations, how it all fits together.
Yeah, and you've probably got, stacks of articles, guidelines, maybe. It can feel like a bit of a jigsaw puzzle.
Exactly. That's why we're here. Today, we're doing a deep dive into those really tough ethical calls healthcare organizations have to make.
And also why understanding health policy is just, well, essential for everyone in the field.
Plus, we'll get into some practical strategies for making hospitals and clinics safer and boosting the quality of care patients actually receive.
And we've looked at quite a mix of stuff for you. There's an article digging into the ethical tightropes managers walk, a paper on how health policy gets put into action, particularly in developing nations, which has some interesting insights.
Okay.
Then there's a review covering what health policy training actually looks like these days.
We've also got info from accreditors like NABH and consultants like Supremediq.
Right, and an article really hammering home why clear hospital policies are so fundamental.
And finally, a bunch of resources focusing squarely on patient safety and quality improvement. Lots to cover.
Definitely.
So, our mission today is pretty simple. Pull out the key takeaways from all that. The ethical knots managers face, why policy education matters so much, and, importantly, those actionable steps for safer, better quality care.
Basically giving you the shortcuts to understanding how these pieces connect without drowning you in details.
Perfect. Okay, let's start unpacking this. First up, those ethical dilemmas. They seem central to healthcare management.
They really are. At its core, it's this constant balancing act. You've got the needs of the patients, obviously paramount,
Right.
but also the needs of the staff, the doctors, nurses, everyone working there. And then the organization itself needs to, well, stay afloat financially.
And those interests don't always line up perfectly, do they?
Not at all. Often they conflict. The article we looked at really stresses that there's no magic bullet for these situations.
No easy answers. So what does the article suggest? How do managers navigate this?
Well, it points towards a multi-pronged approach. It's not just one thing.
Okay.
It involves things like embedding ethics right into education and training from the start.
For everyone.
Ideally, yes. And developing really clear organizational policies that give guidance when these tricky situations come up.
So people aren't just guessing.
Exactly. Fostering a culture where decisions are made collaboratively, where different perspectives are actually welcomed, and, crucially, having strong institutional oversight. Checks and balances, essentially, to make sure ethical standards are being met.
That makes sense. But things are changing so fast in healthcare, aren't they? Does that add another layer?
Oh, absolutely. That's a huge point. Think about genomic medicine.
Using genetic info for treatment.
Right. Or AI making diagnostic suggestions, or even just the massive rise in telehealth.
Yeah, that exploded recently.
Exactly. All these bring brand new ethical questions to the table that maybe weren't there 5-10 years ago.
So managers need to keep learning.
Constantly. They need ongoing education, they need to practice ethical leadership, and frankly, they need a certain level of tech literacy now, too.
It's not just about managing people and budgets anymore.
Not at all. And these ethical considerations, they stretch beyond individual patient care, too, right? Into public health strategy.
How so? What are some examples?
Well, the article mentioned things like cohort studies for preventing non-communicable diseases, like heart disease or diabetes.
Okay, large long-term studies.
Yes. And the ethics there involve making absolutely sure you have proper informed consent. Do people really understand what they're signing up for?
Right, not just ticking a box.
And data privacy is huge. How is that sensitive health information being protected?
Critical.
And equitable inclusion, are these studies representing all parts of the population or just certain groups?
So the results are actually useful for everyone.
Precisely. And then there's the use of data analytics itself, using algorithms to predict disease risk.
That sounds promising, but potentially tricky.
Very. The potential is there, yes, but we have to be so careful about bias baked into the data or the algorithms.
Bias.
How? Well, if the data used to train the AI mostly comes from one demographic group, the predictions might not be accurate or could even be harmful for other groups.
Ah, I see. So it could worsen disparities.
Potentially, yes. So responsible use, privacy protection, these are paramount. It's not just about can we predict, but should we, and how do we do it ethically.
Makes sense. The article also mentioned community programs.
Yeah, specifically looking at adolescent substance use. The ethical angle there is about needing culturally sensitive approaches.
Because what works in one community might not work in another.
Exactly, and respecting the autonomy of young people, even while tackling a serious health issue. It's a delicate balance.
And even something seemingly simple, like nutritional advice.
Even that can have ethical dimensions, say for patients with liver or kidney disease. The recommended diet might clash significantly with their personal choices, their culture, their lifestyle.
How much do you push versus respecting their autonomy?
That's the question. So tying this all together, that idea of ethical leadership keeps coming back.
Right.
And maybe the toughest part for leaders is striking that balance. We talked about the financial pressures versus the absolute need for quality patient care.
The bottom line versus the bedside.
You could put it that way. Ethical leaders constantly grapple with ensuring money matters don't compromise patient well-being. It really prompts the question, how do organizations actively build that ethical muscle?
That's a huge question.
Mm-hmm.
And maybe part of the answer lies in our next area, health policy training. It sounds a bit dry, maybe, but the sources suggest it's fundamental.
Oh, absolutely fundamental. Health policy is basically the rule book, the architecture for our entire healthcare and public health system.
This shapes everything.
It really does. And there's a growing recognition, highlighted by reports from the Institute of Medicine and others, that we desperately need more leaders who understand policy and a workforce ready to engage with it.
So who's actually getting this training now? We looked at that review by Hyman and Smith. What did they find?
Well, according to the literature they reviewed, the main target audiences seem to be doctors and nurses.
Primarily clinical folks.
Predominantly, yes. And interestingly, the way policy was framed was usually quite narrow, mostly focused on healthcare policy, hospitals, insurance, that sort of thing.
As opposed to
A broader view, sometimes called health in all policies.
health in all policies. What does that mean?
It means recognizing that policies in completely different sectors, like education, housing, transportation, the environment, have a massive impact on people's health.
Okay. So like lack of safe housing impacts health, or food deserts impact nutrition.
Exactly, those kinds of things. But the review found very few training programs actually took that wider lens. Most stayed focused on the healthcare system itself.
That seems like a missed opportunity, maybe.
I think so, especially if we're serious about improving population health overall.
So what did the training itself look like? What methods and content were common?
There was quite a variety. Some articles laid out proposed curricula or framework.
Okay, the theory.
Right. Others described pilot programs, anything from a single-day workshop to year-long integrated courses.
A real range of intensity.
Yeah. And the methods included things like case studies applying concepts to real situations.
Logical.
Experiential learning was big too, like placements in government agencies or advocacy groups.
Getting hands-on experience.
Exactly. Bringing in policy experts to lecture, doing skill-building exercises like writing policy briefs or practicing testimony.
So trying to build practical skills, not just knowledge.
That seemed to be a goal. And the content themes were fairly consistent.
Like what?
Things like healthcare costs and financing, always a big one.
Understandably.
Current policy trends, the structure of the healthcare system, how we measure quality, understanding the actual policymaking process.
How laws get made, how regulations are written.
Right. Also, population health issues, policies affecting vulnerable groups, ethical and legal dimensions, how to communicate policy ideas effectively, advocacy skills.
Wow, that's quite comprehensive.
It covers a lot of ground. And importantly, the role healthcare professionals themselves can play in shaping policy.
So, moving beyond just being affected by policy to actually influencing it.
That's the idea.
But were there roadblocks? Challenges in making this training happen?
Oh, yes. Several were mentioned frequently. One was just a perception issue. Some clinicians didn't see how policy was directly relevant to their daily work.
I just treat patients. Policies for someone else.
Sort of, yeah. Resource limits were another big one. Funding, faculty time.
Always an issue in education.
Finding faculty who actually have deep policy expertise. Scheduling, fitting it into already packed medical or nursing curricula.
Yeah, that's tough.
And even the experiential learning part had hurdles, finding good placements, getting the necessary ethical approvals for projects.
Logistical challenges. So, looking at that whole review, what really jumped out at you?
Two things, really. First, the almost shocking lack of focus on health disparities and health equity in the curriculum content they reviewed.
Really? Given how much we talk about inequities.
Exactly. It felt like a major blind spot in the training being described. That was concerning.
Definitely. And the second thing,
The clear value placed on interactive experiential learning. Reading about policy is one thing, but actually doing something related to it seems much more impactful.
learning by doing.
Pretty much. So the big takeaway for me was the need to really push for that broader health in all policies perspective in training if we want to tackle the root causes of poor health in the population.
Makes total sense. Okay, shifting gears slightly, let's talk about the nuts and bolts of running a hospital, those policies and procedures. They might seem mundane, but they sound crucial.
They are absolutely crucial. You can't run a reliable, efficient, safe hospital without well-defined policies and procedures. They touch everything.
How so? Let's break down why they're so important, starting with patient safety. Seems like the top priority.
It has to be. Policies are essential for standardizing care. Think about basic but critical things like hand-washing protocols or how patient charts are documented or how medications are checked and given.
Things that need to be done the same way every time by everyone.
Precisely. Clear policies ensure that consistency, and that directly cuts down on errors, prevents infections, and guides staff in making the right decisions, especially under pressure.
So it reduces guesswork in critical moments.
Exactly. When protocols are clear, people can act confidently and correctly.
Beyond direct patient care, do policies help with just the internal workings of the hospital?
Immensely. They're huge for improving communication and smoothing out processes. Clear procedures for things like patient handoffs between shifts or departments.
Which can be points where errors happen.
Very common points, yes. Good policies there foster better teamwork because everyone knows their role and what's expected.
Clarity of roles and responsibilities.
Right. There was a statistic mentioned about how many workplace errors stem from communication failures. Clear policies directly address that.
And having them easily accessible helps too, presumably, like in a searchable database.
Oh, hugely. If staff can quickly find the policy they need, when they need it, that makes a massive difference compared to digging through binders.
Good point. And then there's the whole compliance side of things. Regulations, accreditation.
Absolutely critical. Hospitals swim in a sea of rules, healthcare laws, accreditation standards from bodies like NABH, licensing requirements.
It's complex.
Very. Solid policies and procedures are basically the evidence that the hospital is following those rules. They're essential for demonstrating compliance and reducing legal risks.
So what kinds of policies are we talking about? Can you give some examples?
Sure. There are broad categories. You've got patient care policies, admission, discharge, charting standards, patient rights, infection control, very core stuff. Then medication policies, how drugs are prescribed, stored, accounted for, disposed of safely.
Very important.
IT policies are massive now. Data security, protecting patient privacy under IPAW, appropriate use of systems.
Can't function without those.
And HR policies, of course, setting expectations for staff conduct, vacation procedures, even rules around social media use.
It covers almost every aspect of the operation. So just having policies isn't enough.
Right.
They need to be managed.
Definitely not enough just to have them. Effective management is key. That means regularly reviewing and updating them. Are they still current? Do they reflect best practice?
Things change.
Constantly. Then making sure they're actually distributed to the staff who need to know them. Communication is vital.
People need to know the rules to follow them.
And then implementation, making sure they're actually being followed consistently across the board. Again, this is where digital policy management systems can be a huge help.
Making them accessible, trackable.
Exactly. Tracking who's read them, simplifying updates, ensuring everyone has the latest version. It streamlines the whole process.
Okay, so we've got the ethical compass, the policy framework, the operational rulebook. Now let's focus on the ultimate goal: patient safety and quality improvement.
Right. Patient safety is the bedrock. And the resources we looked at really emphasize it requires a systematic, proactive approach, not just reacting to problems.
So training plays a role here too.
A big role. Programs like the one from the SPSC-WHO Collaborating Center aim to give healthcare providers and leaders the context, the principles, the skills they need for patient safety.
What's a key focus of that kind of training?
A really important element is fostering a no-blame, transparent culture.
Meaning
When errors happen, and they will happen, the focus is on learning why they happen systemically, not on punishing individuals. People need to feel safe reporting errors and near misses so the system can learn.
shifting from blaming people to fixing systems.
Yeah, that's the goal.
Okay, so if we want to actively improve safety and quality, what are the effective strategies? The AHRQ handbook had some ideas.
Yes, several key ones. First, the importance of measurement. You can't improve what you don't measure. So using data and benchmarks to track progress is fundamental.
Got it. What else?
The whole philosophy of continuous quality improvement, or CQI/TQM. It's this mindset that improvement isn't a one-time project. It's an ongoing, constant effort to refine processes.
Always looking for ways to get better.
Exactly. Then there are specific methodologies like lean.
Lean, I've heard that term, often in manufacturing. How does it apply here?
It's about identifying what the customer, in this case the patient, truly values, and then ruthlessly eliminating any steps in the process that don't add value. That's called waste.
So cutting out unnecessary steps, delays, inefficiencies.
Right. It aims to make processes smoother, faster, and more efficient, which often translates to better and safer care.
Okay. What about when things do go wrong?
That's where root cause analysis, or RCA, comes in. We mentioned the no blame idea. RCA is the tool for that.
How does it work?
Instead of just saying Nurse X made a mistake, RCA digs deeper to ask why the mistake happened. Was the protocol unclear? Was there a staffing issue? Was the equipment faulty? It looks for underlying system failures.
To prevent it from happening again.
Exactly. The VA's use of aggregate RCA is interesting. They look at patterns across multiple similar incidents to find bigger system issues.
And being proactive. Preventing errors before they happen.
That's where failure modes and effects analysis, or FMEA, is used.
FMEA, how's that different?
FMEA is perspective. You take a process, map it out, and systematically brainstorm all the ways it could potentially fail. What could go wrong? What would the impact be? How likely is it?
So you can build in safeguards beforehand.
Precisely. It's about anticipating risks. And then there's the Plan, Do, Study, Act cycle, PDSA.
PDSA.
Yeah, it's a simple but powerful framework for testing changes on a small scale. You make a plan, try it out, do, observe and measure the results, study, and then based on what you learned, you adjust your plan act for the next cycle.
So small, iterative improvements, not trying to boil the ocean all at once.
Exactly. It allows for learning and adaptation as you go.
These all sound like great tools and approaches, but what makes them actually work in a busy hospital or clinic? What are the critical success factors?
Well, the sources point to several key things. Strong leadership support is non-negotiable. Leaders have to champion this work.
Set the tone from the top.
Absolutely. Then, that culture of safety and improvement we talked about has to be real, felt by everyone.
Not just posters on the wall.
Right. Involving everyone getting input from frontline staff is crucial. Using multidisciplinary teams.
Different perspectives.
Really understanding the problem and its root causes before jumping to solutions. Using proven improvement methods, like the ones we just discussed. Standardizing care processes where it makes sense, based on evidence. Being flexible enough to adapt. Having enough resources and, importantly, giving staff dedicated time for this work.
Time is always tight.
It is, but it has to be prioritized. Continuously collecting and analyzing data to see what's working. And, maybe most importantly, understanding that real change takes time and persistence.
It's a marathon, not a sprint.
Yeah, definitely. And just briefly, different tools have different strengths, right? RCA helps figure out why something went wrong to change the system. Six Sigma methods, related to lean, are great for reducing defects and variation. PDSA is for that step-by-step implementation. FMEA is for looking ahead at risks.
Using the right tool for the job.
Exactly. And underlying all of this, as one article really highlighted, is the training of the staff themselves.
Bringing it back to people.
Always. Well-trained, competent staff are just fundamental. They're the ones delivering the care, following the procedures, identifying potential problems. Better training leads to better compliance, fewer accidents, and ultimately better patient outcomes.
It all connects back. Okay, so as we wrap up this deep dive, we've covered a lot of ground.
We really have.
We've seen how ethical leadership is vital for navigating those complex healthcare dilemmas, how solid health policy training is essential to build a workforce that can actually shape a better, more equitable system.
Right.
How clear policies and procedures form the backbone for safe, reliable day-to-day operations.
The operational foundation.
And how systematic quality improvement strategies, powered by well-trained staff, are the key to actively making care safer and better for patients. They're all interlinked, aren't they?
Absolutely. You can't really separate them. It demands this holistic view, weaving together the ethics, the policy understanding, the operational clarity, and that relentless drive for improvement. It all needs to be part of the culture.
So for you, our listener, as you think about all this, maybe a final thought to chew on, what do you think is the single biggest hurdle to getting to a truly ethical, high-quality healthcare system?
Is it maybe a knowledge gap? Do people just not know enough about these tools and principles?
Or is it more about implementation? We know what to do, but actually doing it consistently in the real world is the hard part.
Or maybe it's something deeper, inherent tensions in the system itself, those competing priorities we discussed earlier.
Food for thought. And importantly, what's the role you can play, wherever you are in the system, in nudging things in the right direction?
We definitely encourage you to dig deeper into these ideas and the resources out there.
Thank you so much for joining us for this deep dive.